All right. Well, first I want to address the skin issue. So loose skin is related to low B12, low zinc, and low thyroid. So mommies who have tummy tucks after they've had babies, if the skin is not elastic enough to go back to the way it was before, that's often a thyroid issue. I have patients coming to me with, this skin is not taut enough, or the skin has to have a certain amount of elasticity. Ligaments can also become too stretchy. So stretchy skin, stretchy ligaments, uterine prolapse, things like that. Basically, it's not because you had a couple of kids, it's because you are probably hypothyroid because your ligaments have become too lax and they don't have the stretchiness again. Yeah, I recommend weight training. Definitely. Not cardio, because if you had cortisol issues before, having vaginal dryness would mean you had cortisol issues, would mean you had high cortisol. So I, on a 75, 76 something fat to 24 protein, built 3 kilo in muscle in 2 months. I was just paddleboarding. My husband had to rehabilitate his knee, so he joined a gym, so I did too. And I'm 60, and I did it on a high fat diet. So it's possible. Fewer reps, higher weight. Absolutely.
I like 3. Less is more, just 3 reps heavy, and then
they're trying to get into cardio.
Yeah, I think that's the biggest mistake, especially our endurance athletes listening tend to do cardio for training for races, and then they stop racing, and then they're just still doing the cardio, not focusing on the strength part. And as we age, I think that's huge.
Okay, so a salivary cortisol test, because if you have cortisol issues, your body will be in fight or flight, either low or high. Your body will be in a hypersympathetic state, and hence it thinks it's in danger. Hence, it will hold on to weight in order to give you the calories to run like hell from danger. So it doesn't know that you're under stress. It doesn't know that you're possibly abusing your cortisol system. It just knows that you're in a fight or flight state, which is also inflammatory. And when that is turned off or addressed, weight usually comes off. Thyroid is also important to test because the thyroid regulates metabolism. So the person who had 700 total cholesterol and 170 or 200 triglycerides, that person who was a patient had a thyroid issue. And as soon as we addressed the thyroid function, the cholesterol dropped and the triglycerides dropped. So the inability to metabolize energy in itself is a thyroid, a hypothyroid symptom.
So their follow-up questions were, how long on carnivore should one give to start experience changes in hormone balance?
So the endocrine system uses a 30-day cycle for both men and women. So definitely give, a month or so. Not fasting, weight training. I would say, well, there is no premenopause because you are either fertile or you're not. So perimenopause was invented in the 80s, doesn't exist. The symptoms that people have are related to cortisol issues. So I would say, again, a 75-25 ratio of fat to protein for somebody who doesn't have huge inflammatory issues. Women, we evolved to look down and say, oh, at 18, not 12 or 11.
Yeah.
Oh, I'm bleeding. There you go. I got my period. And then when we are, however old we are in our 50s, we look down and we no longer have our period. We're not supposed to have PMS or whatever they call it now. We're not supposed to have any symptoms. This is a natural occurrence that is not supposed to come with pain or issues of any sort. The child to fertile biological being to incredible older woman who, like the orcas, leads all the pods to the hunting grounds. There are libraries of knowledge. So older women ensure that grandchildren, the species survives.